Help me welcome Dr. Sandra Mutilva. She's a manager of the International Midwifery Preregistration Bridging Program at the Toronto Metropolitan University. Now, Dr. Mutilva is a healthcare executive, academic, and midwifery leader with over 25 years of experience, spanning clinical practice, health policy, and education across Latin America and Canada. As former registered midwife and midwifery chief at the Ottawa Hospital, now the International Midwifery Pre-Registration Bridging Program Manager at Toronto Metropolitan University, she brings deep expertise in regulatory integration, culturally safe care, and systems level change. She's passionate about advancing equity-informed pathways for internationally educated midwives and leveraging innovation, including artificial intelligence, to modernize health professions, education, and care provision. So please help me welcome Dr. Sandra Mutilva as she speaks to us about what the G. Raymond Chang School at the Toronto Metropolitan University is doing to change that landscape for the integration of our internationally educated midwives in Canada. Thank you. Please help me welcome.
Thank you for the opportunity. Thank you for having me and for this opportunity to present about this new brand bridging program for international educated pre-registration bridging program at Toronto Metropolitan University. I would like to start by acknowledging that Toronto Metropolitan University is located in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent indigenous nations and peoples, Europeans and all newcomers, have been invited into this treaty in the spirit of peace, friendship, and respect. So it is an honor for me to present within this territory. So I just want to present a little bit of background related to this new international bridging program for midwives. So before this program, there was the International Midwifery Pre-Registration Program, where I graduated in 2004. I am Argentinian, so I got my license there. I practiced there for several years, and then when I immigrated to Canada, I was able to go through this program and obtain my license in Ontario. So that program ran from 2002 to 2021, and then it stopped. And since then, there were 347 students that graduated the program, 301 practice in Ontario, 46 of these international trained midwives are practicing right now outside of Ontario. And one of the features is that 99% of the graduated from this international bridging program passed the national registration exam, which is the Canadian Midwifery registration exam in the first attempt. So currently, besides the, so from 2021 and now, there was time to reimagine in a new brand program to help internationally educated midwives to find ways to obtain license. So the program has been rebranded, and this is the first iteration, the first cohort has been just admitted. So there are other programs for international educated midwives in Canada. One is the International Educated Midwives Bridging Program, which is in British Columbia. There is one in Quebec, and this is the one for international educated midwives who are fully Francophone. And then there is another program, another bridging program in Alberta, in the College of Alberta. So this is a very, very high overview of the status of midwifery in Canada. So for people that study midwifery in Canada, midwives here in Canada are highly trained professionals and are required to complete a 4 years university degree, which is quite demanding. I teach at the ML, some of the subjects, and it is quite demanding and quite intense. So working as a midwife requires lots of time management and flexibility because midwives are on call a lot. And so it is really demanding, so it requires quite of time management, and also is based in the continuity of care, so you need to follow your clients through a continuum. It requires of care, compassion, and ready for and collaboration, because midwives don't work in silos. So there are approximately 90 new midwives that graduated every year from the different schools. There are 6 university schools that where midwives are being graduated, plus these bridging programs for international educated midwives. So in a study that was done by the Canadian Association of Midwives, estimates that there is a need for additionally 9,000 midwives by 2030 to meet the population requirements. Midwives are in high demand. I remember that when I was practicing, we had lots of waiting list of people that wanted to have midwife and couldn't access to the care. So this is how a high level also how midwifery is distributed in Canada. So as you can see, the province that have the bigger amount of midwife register is Ontario, and then followed by British Columbia. So there are currently around 2,153 midwives in Canada that support around 45,391 births. So that is around 13% of the population. In Canada, midwifery is a regulated profession. Each province has its own regulatory body, province or territory. And continuity of care is one of the components. That means that midwives are going to be following their clients during their pregnancy, delivering their babies, and then providing care for the new parent for between 6 and 8 weeks, and the newborn. So there is an emphasis on informed choice. That means that midwives needs to provide lots of information to their clients and knowledge for them to be able to make the best decision for their care. It's client-centered, and there is, as I mentioned, expected that midwives are going to be functioning in interprofessional collaboration environments. Midwives here in Canada, they practice they provide care in the community, they perform home birth, birth centers birth, and also they work in hospitals. So most of the provinces, their model of work is independent. In some places, midwives are employed by a hospital, but they are not. There is not in many cases. So what is the International Midwifery Pre-Registration Bridging Program? So this is so the main difference with the anterior program that ran at Toronto Metropolitan University is that this is a pan-Canada bridging program for internationally educated midwives. So that means that you can't, if you're an international trained midwife, you can apply for this program in any area of the country. It is offered at the Chan School of Continuing Education. It is a blended delivery, online and in person. So that means that you can, is hybrid. The duration is between 6 to 9 months. So you can take more than one course at a time, or you can take maybe one course at a time. So right now, the cohort that started is going to be finishing the program in April, so they will be ready to write the examination the national examination in May. So there are two times of a year that the national registration examination runs, that is in May and in October. And it is a competency-based base program that is aligned with the Canadian midwifery standards. So that means that midwives are going to be assessed based on the primary care, advocate, their communications, their collaboration, their professionalism, life learning abilities, and then and their leadership abilities. So the criteria is that so for being admitted into the program, they have to be permanent residents or Canadian citizen, protected person, international students with a student visa or work permit holders. Their university or school transcripts need to be assessed by a credential assessment report from an acceptable credential evaluation service here in Canada. They might have an undergraduate degree holder from a formal educational organization in midwifery or equivalent. So something that we also had, several physicians that applied for the program and they were accepted. We have several OBGYNs that applied and in the past, and right now they are working as midwife, and they are quite successful. So they have to practice in the role of primary midwifery within the past of 10 years, provide evidence of attended at least 100 births, and then they have to have proof of language proficiency for English. And then if you are doing your applying in Quebec, of course, is in French. So the program offers orientation to clinical placement, a skills workshop. So some midwives are coming into so in some regions of the world, midwives are only practicing in hospitals and they are quite dedicated to labor and delivery, but here midwives will need to do so the scope of practice is maybe bigger because they will need to do pregnancy clinics, reproductive health clinics. They will need to work with the newborns. So we are trying to prepare the international educated midwives to perform in different settings, preparing the midwives to pass the Canadian midwifery registration exam. And then, so most of the faculty and mentorship that is available in the program, they have been international educated midwives, or they have exposures to global health. So this is how the program is being structured. So the first course, which is the midwifery skill assessment, we just ran one of them, and this is the assessment let's put course that they have to perform in order to be accepted into the program. That consists for 2 full days of there is training in the morning and then exams in the afternoon. There is 1 day of OSCEs. There is an interview, and then based in all that information, the candidates are being assessed to whether they are recommended to enter into the program. All the courses are online or in person in campus, except for the clinical clerkship, where midwives will need to go and work and being assessed in a clinical setting. So that is in person, and so we are working with different jurisdictions to support relocation of these internationally educated midwives to do their clerkships in these in different regions or territories in the country. There is also an option for extended clinical clerkship of 4 more weeks. Once they pass all these courses, they will be ready to write the national exam and then recommended for registration with a regulatory body. So we understand that there is transitioning to midwifery practice in Canada might be quite hard. Here in Canada, midwives, they need to be very good communicators because of the informed choice piece of the profession, in which you have to be, you have to provide knowledge or share knowledge with your client, so they can do the best decision for their care. It's based on health equity. Here in Canada, regulation is quite diverse, so midwives will need to be ready to practice with cultural affirmative or gender affirmative settings. And there is, of course, systemic differences from countries of origin that we are quite aware. So we are, during the program, we are trying to help to bridge those transitions. Between 2021 and October 2024, we have done lots of research in order to find which are the system level barriers for internationally educated midwives. And what we found is not different of what other speakers have presented during this forum. There are inconsistent regulatory pathway across provinces. So that is, so there is different regulatory bodies according to the province that you are going to be working. The cost for credentialing is keeping your license as a midwife in Canada is expensive. You have to pay your college fees, your association fees, and then there is also lots of in order to maintain the license, you have to acquire constant certifications in newborn training, emergency skills. So for a newcomer who just completed this program, it could be quite expensive. There is limited access to clinical placement. As it was mentioned here before, Canada is going through severe issue with working with a workforce that is quite exhausted. So that means that sometimes it takes a lot of work in order to find preceptors and people who are willing to be assessors. Besides, so that means that taking them out of their clinical practice. So language barriers, there is not a language training that is tailored for in the midwifery context. And then, as women, so this is found in the literature, there is implicit bias in assessment, clerkship, and admission process that is also, found in the literature. So there is, while the candidate is in the program, they will have access, because it's part of the Toronto Metropolitan University, they will have access to academic support, mental health, financial aid. There is an option that we presented. And then, of course, access to alumni and mentor networks. So there are partnerships and opportunities. So I'm glad that you invited me here in order to explore collaboration with other regulatory bodies, how we can support internationally educated midwives to integrate in underserved communities, and then we need to have a better national midwifery workforce data infrastructure that is not available yet. And so I'm going to lead with a call to action. So we need to, right now, because this program is quite expensive, so it would be great to have funding available so we can support Sandra, international trained midwives, educated midwives to be successful there in the program. It would be great to remove the silos between different regions for regulation, help for relocations, and provide support for cultural safe care among international educated health providers, and include midwifery in a federal strategy. So policy planning. So thank you, and this is my information, and so you can connect with me and be open for questions if there is time. I know that there is lots of information, but I appreciate the opportunity.
Okay, awesome. So do we have any question for Dr. Sandra Mutilva? Feel free, if you have questions, you can post them in the chat, or you can raise your hand, open the microphone, and speak to us. All right, so thank you so much, Dr. Mutilva.